Kawasaki disease was first discovered in Japan by a pediatrician named Dr. Tomisaku Kawasaki. He encountered several cases of children with a set of symptoms that seemed to be distinct from other known childhood illnesses. Dr. Kawasaki initially reported these cases in a medical paper in 1967. The disease late came to be known as Kawasaki disease, in honor of Dr. Kawasaki, as contribution to its recognition and understanding. Kawasaki disease, also known as Kawasaki syndrome, is a rare but potentially serious illness that primarily affects children, usually those under the age of 5. It is characterized by inflammation of blood vessels throughout the body, particularly the small and medium-sized arteries, which can lead to a variety of symptoms and complications. The exact cause of Kawasaki disease is not fully understood, but it is believed to involve an abnormal immune response triggered by an infection or other environmental factors in genetically predisposed individuals. The disease tends to occur in clusters, suggesting an infectious component, but no specific pathogen has been consistently identified as the cause. Common symptoms of Kawasaki disease include fever. Prolonged high fever, usually lasting for at least 5 days, is a hallmark of the disease. Skin changes. Rash, often on the trunk, genital area, and extremities. The rash is usually red and may involve peeling of the skin around the fingers and toes. Swelling. Swelling and redness in the hands and feet, often followed by peeling of the skin. Conjunctivitis. Redness and irritation of the whites of the eyes, conjunctivitis. Swollen lymph nodes. Enlarged lymph nodes, typically in the neck area. Irritability. Children may become irritable due to discomfort caused by the other symptoms. If left untreated, Kawasaki disease can lead to serious complications, particularly affecting the heart and blood vessels. These complications can include inflammation of the coronary arteries, the blood vessels that supply the heart, which can potentially lead to aneurysms, weakening and bulging of the arterial wall. If aneurysms form, there's a risk of blood clots and other heart problems. Prompt diagnosis and treatment are essential to reduce the risk of complications. Treatment often involves administering intravenous immunoglobulin, IVIG, and aspirin to reduce inflammation and lower the risk of blood clot formation. With timely and appropriate treatment, the majority of children with Kawasaki disease recover fully without lasting effects. If you suspect that your child might have Kawasaki disease due to the presence of the symptoms mentioned above, it's crucial to seek medical attention as soon as possible.